Perfect. All right. Hello, everyone. Welcome to this month's webinar. I'm so excited to be here. My name is Erica. I am the community manager here for AskVet, and we have Dr. Marks here. She is going to talk to us today about pet dental health because it is Pet Dental Health Awareness Month. So I'm going to go ahead and let Dr. Marks take it away. If you have any questions, put them in the chat. We will get to them at the very end for you.
All right. Happy Thursday, almost Valentine's Day. This is one of my favorite things to talk about because I don't think I've worked with a family in the last 20 years that hasn't experienced some type of dental disease with their dog or cat. It is really, really common. And I think most of us on this call would look at this mouth. It's pretty obvious that this dog has really been suffering with dental disease. We don't have to have any type of medical training or even just a quick type of webinar like this to understand that those teeth look abnormal, right? They definitely are discolored, and I'm sure you can envision how this dog's breath smells, right? But what I want to do in the next few minutes with you today is talk about some of the lesser known signs of dental disease that still mean that there's something going on in the body, and easy ways that you can spot them at home before they become really advanced or, more importantly, really painful. So a lot of people will come and see me and say, you know, I had lots of dogs growing up. We never took them to the veterinarian. They never had their teeth cleaned. They did just fine. And they may have, and that's certainly possible. However, there's been a lot of advances in our world in veterinary medicine and understanding the role of oral health with our dogs and cats specifically, and certainly other smaller mammals. But the reason that we need to worry about this is twofold. So over 80% of dogs and 50% of cats over the age of 3 have dental disease. So that's a really young age for disease when we think about a lot of the other things we can worry about with our dogs and cats typically happen more in their middle-aged adult or senior years. When we think about diabetes or kidney failure or thyroid disease or, God forbid, cancer, right? But this is a disease that a lot of our pets, majority of our pets, experience very early on. Now, there's lots of ways we can help prevent some of this, which we'll talk about at the end. But the other thing that's even more important to remember is this. Untreated dental disease actually can create a lot of problems for your dog or cat inside the body, very similar to how it happens with humans. Those bacteria that get trapped under the gum, we can't see them, and we can only appreciate what changes they've created when we look at dental x-rays, actually will go into the bloodstream and circulate throughout the body, going to the heart and lodging on a valve that's called endocarditis. It's very serious. Liver, and also the kidneys. And that can either create new disease, or if your dog or cat currently has heart, liver, or kidney disease, it will worsen the disease they have. So untreated disease is unfortunately a big risk factor for shortening lifespan, worsening a disease they already have, and it's really painful. I don't know if any of you have ever suffered from your own dental disease. I can tell you just my own impacted wisdom teeth was horrific. Going through not only just dealing with getting the surgery, but the recovery process of that. We know now, especially for all of you cat moms and dads listening, untreated and undiagnosed dental disease is one of the most common sources of chronic pain for cats today. So I think we could all empathize and appreciate that a mouth this red is really, really painful. So for us to kind of take charge and be more proactive at home and identify things before we end up having to go to a veterinarian and unfortunately end up with either full mouth extractions or really advanced oral surgery, here are some of those lesser known signs of dental disease so that we can all be on the same page and do the best for our family members at home, however they may look. Real quick though, oh, I gave it away. Real quick, for us, you know, as I mentioned on that first image of that Yorkie, Discolored teeth and red gums are probably the most common. We call that discoloration on the teeth, that yellowing or even the green or sometimes even brownish colored material. That's plaque and then becomes tartar when it's calcified. That's what happens when bacteria combines with the calcium in your dog or cat saliva and becomes a film on the teeth. And again, when it's fully calcified, it becomes that chunk material, which is tartar. Red gums, the fancy term for that is gingivitis or inflammation of your gingiva. Broken teeth and bleeding from the mouth, that's all stuff that's pretty easy for us to see. The number one indicator of dental disease, I don't think anyone would argue, is definitely bad breath. What we're smelling there, that fancy term again is halitosis for bad breath. That's actually the gas that is a waste product of bacteria that is sitting in the mouth. And so we can, again, have a pretty good sense that bad breath is a culprit for dental disease, although we can also have some pretty unique odors to the breath with other types of disease, including end-stage kidney disease. So it's not pathognomonic, it just doesn't mean just one thing, but certainly bad breath, I think, is the most noticeable, especially if you're snuggling in bed with your dog or cat, or they're giving you kisses and you get a pretty horrific odor that's wafting across your face. I think most of us would anticipate talking to our veterinarian about that. But in dogs, 3 signs that you may not recognize or might subtly miss that we don't want to ignore. And those 3 we're going to go through in pictures: swelling under the eye, drooling, and dropping food. These are 3 pretty worrisome indicators to us of dental disease, but for pet parents at home, and again, including myself, who I've missed one of these before in a previous dog, we might overlook it or attribute it to something else. So if you look at this dog on the right, where that arrow is pointing, that swelling under the eye, the most common reason for that is actually a tooth root abscess of the 4th premolar of the upper jaw. So the fancy word for that is the carnassial tooth. It's circled there with the arrow on the left. And you can see there's sort of this black hole that's sitting on the crown. That's a fractured tooth. That's the largest chewing tooth on the upper jaw. And when that's fractured, it basically opens up Pandora's box. So what the bacteria can then do is go through this little port in the tooth, go up into the blood supply and the nerve supply, and cause an abscess, so a big pocket of bacteria sitting at the root. There isn't space in dogs and cats' mouths for there to be swelling at the roots of teeth, especially on the upper jaw. It's got to go somewhere, which typically goes out or up, pushing on the eye. So that is, to us, an emergency. That is a tooth root abscess of the largest tooth of the mouth. It's very painful for dogs. We see this more in dogs than cats, as I've mentioned, but we can see it there. And it definitely requires oral surgery. So that tooth either needs a root canal, in this case, because it has 3 roots, it would need 3 root canals, or needs to be extracted, and definitely antibiotic therapy and pain medication as well. So this is a significant sign of dental disease. And again, in this case would be a fractured 4th premolar, the largest tooth of the upper jaw. The next thing that we see that a lot of times is mistaken for something else outside of dental disease is drooling, especially in our smush face dogs, these brachycephalic breeds like pugs and Bostons and bulldogs and other alike. And when we see drooling, a lot of times it's because they have pretty significant painful disease in the mouth. And when we actually look in the mouth, especially if this is a dog that hasn't let us look for a while, we'll see something like this, which for all of you, I'm sorry, if you're eating lunch right now, this is probably not necessarily those for a weak stomach, but unfortunately, this is things we see pretty frequently. And this is a dog that has a really significant abscess of basically all of those teeth. And you see the gum is worn away. You actually can see hair stuck there where the roots are. This is a big deal for us because this dog, this patient is obviously in pretty advanced disease, is going to need all of those teeth extracted. It's probably pretty painful. And you also see in this pug there's a little bit of nasal discharge. We will see that very frequently when a canine tooth, so this big fang tooth, looks like this, where the gum's worn away and the bacteria can get under the gum line and create an infection, because actually the nasal passage, the nostril, so of that dog, and the root of the canine tooth are millimeters apart. So when there's a tooth root abscess, we get what's called a fistula, a hole between where the tooth and the nostril live, and things will then come out the nose. So that's called an oral nasal fistula. So this is also just like that tooth root abscess in that shepherd, this is a big deal. And definitely if your dog is drooling, it is time to flip the lip, look at those teeth, look at those gums, because it can be one of the major reasons, not the only, but one of the major reasons for dental disease and drooling. The third, and this I think is probably the most frequently missed at home, is a dog who's dropping food. Now, I have a lot of clients and friends and family who have dogs that are just really messy eaters. And they go to the bowl and pick up a huge chunk of food and they're kind of dropping it as they go. And then they kind of clean and vacuum it up later, right? These are dogs that are not classically like that. So if your dog is fastidious and eats one kibble at a time out of that bowl, licks it clean, never drops, and now all of a sudden is sort of picking up the food kind of like that claw machine, like at the carnivals, it's kind of going and kind of messily grabbing for food. That's because it's painful to chew. And it might be that now they're chewing only on one side because the other side hurts. So they're moving their jaw, forgive my motions, but moving their jaw in an odd manner. So food is dropping out. It might be that it hurts not just to pick it up, but to actually chew itself. So when they try to chew, they can't chew with the right force or motion anymore. And so food is dropping out. That is a big sign, again, just like with the drooling, to lift the lip and or see your veterinarian, because there usually is a reason. Now, sometimes I have been completely fooled and a pet parent has said, you know, Jake's here. Jake was always eating everything in 3 seconds. And now he's picking things out left and right and he's dropping food. I'm worried about his teeth. And I look in his mouth and everything is sparkling, like he should be a tooth model. But then when we look under the gum line on dental x-rays, sometimes we will see disease there that we can't see with our naked eye, like broken roots or tooth root abscesses, or maybe there's a tiny little hole in one of those teeth that we can't appreciate just with me glancing in an exam. So oftentimes we will not just need the visual exam, but also the x-rays, very similar to what we have, right, at our normal checkups, to make sure that there's not disease happening both above and below the gum. So those are the big three in dogs of those subtle signs not to miss: dropping food like this dog here, drooling, and then the swelling under the eye. So let's shift over to cats. Cats are so stoic. They don't let us see anything that they don't want us to see. But here are three things that definitely mean we need to have those teeth looked at. They're just not as common, again, as bad breath or discolored teeth themselves. This is the biggest one. So if you are a cat parent, this is the one to pay attention to for sure. And this is called a resorptive lesion, otherwise known as a FORL. If you really want to get technical, feline odontoclastic resorptive lesion, just call it a resorptive lesion. So if you see on the right, this is a canine tooth, this big picture here, and this red dot, which the arrow should come in there, okay? We will see little red dots along the gum line, but actually on the crown of the tooth from the canine all the way back. And they're really subtle and they're hard sometimes to see, but when you see them, it is highly likely that something is happening underneath the gum. Now, if you look at the picture where the x-ray is, you'll see that what that looks like under the gum is a dissolving, disappearing root. Best way we can describe it is in cats, it's multifactorial. So there's lots of reasons that contribute to this, but a lot of it is genetic based. What ends up happening is some of these cats get a signal that the tooth roots are bad. and they shouldn't get any blood supply anymore from the body. And so they start to basically erode away and dissolve, and the body absorbs them. So it's sort of like having a tree where all the roots died. At first, the tree, or in this case, the tooth, looked totally fine. But as that tree and the tooth lose nutrients, lose blood supply, food, all that stuff, it ends up weakening and chipping away. And eventually what happens with these is that little red dot becomes a big red dot, becomes a big red crater, and the tooth fractures, which is even more painful. So these resorptive lesions, very, very common, very, very painful in cats. And as you're flipping the lip, if you see that, that is a very significant indication to see your veterinarian and talk about options for therapy. Most of the time it is extraction, and I would say 99% of the time. However, what we're trying to do is really avoid pain and secondary infection, because you can see the reason it's red is because the blood supply is exposed. And so bacteria can get in there just like we saw in those dogs. The second thing to watch for is pawing at the mouth. Now, a lot of cats will do this beautiful grooming behavior where they rub their cheek glands, and that's typically around bathing time or when they're feeling really good or relaxed. However, if you see your cat pawing at his or her mouth around feeding time, so it goes to eat, tries to eat, and then paws at the mouth. And this is more, and I never do cats justice, so forgive my acting skills, but it's a more aggressive pawing, not that kind of kneading pawing that you'll see. Or if you give your cat a toy to carry in the mouth, or you're trying to rub your cat's chin and your cat's uncomfortable and shying away where they used to love that. These are all signs. First, if you can, flip the lip, look at the mouth, and then of course, see your veterinarian, because pawing at the mouth, and cats are very stoic and they don't show signs of pain unless they can't contain it anymore. Remember, innately in the wild, that makes them vulnerable to other predators. So if your cat's pawing, there's pain, and it's significant pain. So definitely talk to your veterinarian. And oftentimes this is what we'll see under the gum, that red inflamed gingiva, again, gingivitis, which is very painful for cats. And then the third thing is appetite change. Now we call this fancy category inappetence. There's lots of different forms of this, but it is a huge sign that something is going on with your cat. Cats should have a fairly predictable eating behavior. Now, I'm not to say every cat is a snarfer, right? Not every cat wakes mom or dad up at 4 a.m., eats all their food, and is ready to eat another meal at 4:30. There are definitely grazers throughout the day. In fact, cats, if they had their choice, would eat small little snacks 10 to 15 times throughout their day. That's perfect for them. But whatever your cat's normal is, if that changes, so if your cat's a snarfer and now it's taking till noon to eat, if your cat is normally eating a can of Fancy Feast a day and now is eating 3/4 of a can of Fancy Feast a day, if your cat normally would eat only with you and now you have to hand feed your cat, right? Whatever that change is that's out of normal means something. And a majority of the time, we do worry about the mouth. So while it's, again, none of these just mean dental disease, but it's very common for us to see that. And even if it's not dental disease, it's usually something else that needs to be addressed. So appetite change in cats is an incredibly important sign to us that something is off. And again, I can't stress enough, these are subtle signs. You don't want to wait, and we don't have to wait till your cat hasn't eaten for 3 days. It's just changes in their routine, little changes out of normal for them. So what are the best ways to prevent these things, all these changes for dental disease? Well, certainly in a perfect world, brushing is best. And every veterinary dentist, I would say majority of veterinarians and other pet health experts are going to agree with that. In reality, I know that's not always possible, depending on your pet's temperament, depending on if you've done training. I rescued a pug who was one of my heart dogs, who I just couldn't even stand to be away from, who would never let me near his mouth. I don't know what led up to that with his fear, but our training never got us to the point where I could safely get work in his mouth. So again, that's not a dog where I would want to be telling a pet parent, you've got to brush 3 times a day, because I know that's not possible. If you can, or if you could pair it like with your children's bedtime routine, it often helps get us in a habit. And certainly with cats, finger brushes are often easier, or using baby toothbrushes, like actual human baby toothbrushes, are a little more feasible and a little less unwieldy in the mouth. But don't forget that there's lots of different options out there for dental care. The key is doing something every single day. There are wipes, there are chews. There are chews now even for dogs and cats that have food allergies. There's lots of great bite-sized treats, like cat greenies are awesome. There's Aquadent, which is a rinse that's put into water. There's actually prescriptive food out there like Hill's TD, which is the tooth diet, where there's a larger kibble. And when your dog or cat actually bites the kibble physically through technology grabs the tooth and kind of wipes the plaque off the tooth. Lots of great technology out there. But like I said, the key is to do something every single day, because it does 2 things. One, it makes you flip the lip. We have to look in our dog and cat's mouths, because oftentimes they're going to hide that from us until it's very advanced. But 2, the more that we can prevent on a daily basis means the less our dogs and cats have to go through what we call reactively. So when they come in to see me and I'm looking at the mouth and dental x-rays are telling me that I have 18 teeth with abscesses, that is a lot for pets to go through under anesthesia. It can be very painful. And of course they're left with, although a healthier mouth, a mouth with less chewing capacity, and sometimes even changes to how they can hold their tongue in their mouth. I'm sure many of you have seen, especially pugs seem to be, and chihuahuas seem to be the culprits here in imagery, but where the tongue hangs out the side of the mouth. And that's because they've lost their ability to have all of their teeth. So again, the key is to make sure you're doing something every single day. And if you are really wanting to learn more about dental health for your dogs and cats, the Veterinary Oral Health Console at this website, vohc.org, is an awesome site. It has everything you ever wanted to know about dental disease, but most importantly, I think is what's helpful, every single product out there that has achieved their seal of approval. And many of these are over-the-counter options that you can purchase online or in stores to really do the best for your dog or cat's mouths. So a great option for you if you want more information just about why dental disease happens or specific questions. But like I said, for Dental Month, the challenge is for everyone to commit to doing one little thing every day, even if it's a chew or a treat, just something to help reduce that plaque and prevent, again, that painful disease that afflicts so many of the dogs and cats I see. So I'll leave this here for Erica, and I'm happy to stay on and answer any questions at all.
All right. Thank you very much. I actually learned so much on that.
Great.
I had a cat that actually started sneezing blood, and it was a tooth abscess. So makes so much sense now that I hear the logic behind it.
Yeah.
We did have a couple questions come in. So someone asked, should I be brushing or using dental chews? So is there a preference, or as long as you're doing something every day, does it matter if it's different?
Yeah, no, great question. And I think this is about Oliver, who's 3 months old. Yeah. So Christy, this is a perfect time to start getting Oliver situated. At 3 months old, we still have most of our teeth are still baby teeth. So we don't necessarily have to brush or do dental chews, because those teeth are going to be gone in a matter of weeks. What's most important is getting Oliver used to the motion. So for puppies and kittens up to 6 months old, it's really best to do 2 things. One is to get them used to being in the mouth, for you to be in the mouth. So we start with just our finger with something super yummy, peanut butter, cream cheese, Cool Whip, whatever your dog or cat prefers. And don't forget, cats really love cheese. People think it's only a dog thing. Cats really love easy cheese. Putting that on your finger, rubbing on the gums, rubbing on the teeth. We're not brushing. We're getting them to associate you touching their teeth as something positive that they like, because they get something super yummy when you're doing that. Also to show it's not painful. And certainly it wouldn't be surprising if at some point of your puppy or kitten's young life, you have to take something out of their mouth that you don't want to be in there. So a little value add there, but it's a great time to get them used to it. Dogs and cats actually have acupressure points in their gums. Acupressure meaning it's a calming release. So if you're just rubbing on their gums, even if it's through their lips, so as I'm doing right now, a lot of puppies and kittens will actually fall asleep because it feels really good to them. So rubbing on their gums with your finger and something yummy gets them trained to accept toothbrushing. So that's the best thing I can suggest right now. It's fine for you to use some of the dental chews, but I would just caution you that between 12 and 16 weeks of age, puppies and kittens are losing some of their canine teeth, and then up to 20 weeks, they're losing their baby molars. When we have them chewing on harder things, it's fine. Those teeth need to be teeth, but you could see some blood-tinged saliva on those treats as they are actually teething. So again, don't be alarmed by that. It's pretty normal to see, but we don't have to do the dental care I'm talking about here, more referencing adults. As puppies and kittens, it's dental training.
Perfect. Christy also asked about the Caesar dry food and sometimes wet. Is it a good brand? And then to kind of piggyback off of that, my own question is, I've heard in the past that wet food is actually bad for their teeth because it doesn't give that crunch. It doesn't clean their teeth. I don't know if that's a myth, because then I've heard it's a myth. So I figured I'd ask and get your thoughts on that as well.
Yeah. And it's commonly discussed. And what we can say is this: wet food does not cause dental disease itself. And dry food does not prevent dental disease itself because it's more abrasive. What happens is wet food creates, because it's typically anywhere from 82 to 86% moisture, right? Obviously a very wet environment, creates more of an environment in the mouth for bacteria to live because of the moisture. So if you're only feeding canned food, which there are some disease states where we prefer canned food, and certainly for kittens, we encourage introducing a variety of foods, dry, different textures, different canned foods, so that kittens appreciate and are kind of adaptable to all types of foods. So if you're feeding canned food because your dog or cat needs it, or it's a treat, that's totally fine. But we have to make sure that we incorporate alongside of that some form of dental disease, because there is an increased risk of more bacteria hanging out in the mouth, which will lead to dental disease. So there's no studies out there that show that if I give my dog wet food, my dog will definitely have more dental disease. We know there's an increased risk, but if your dog is on a diet or a cat is on a diet of what we usually say is 50% or more wet food, we do need to be a little bit more proactive on our daily care. And usually what I say is, if you're doing wet food, a great thing to do, if you're not a good toothbrusher or your dog won't accept it, are just the wipes. Just wipe that film away off the teeth after you're done, or even some of the sprays that are out there. There's a great spray called Oradent that you can get, and it looks kind of like a deodorizer in a way, but it just lift up the lip on each side, do a spray, and your dog or cat will kind of do this almost like they're using a mouthwash. And that's just an antibacterial spray that is similar to us brushing our teeth after we had a sugary snack. So there are definitely ways that you can help decrease the risk of any of that bacteria getting under the gum line, periodontal disease in dogs, because of that added moisture. But I also don't want to discourage people from using canned foods, because there's a lot of benefits to that as well. We just have to make sure that we, acknowledge the teeth along that journey.
Perfect. And is there like a study about brands of dog food that are better or worse aside from the prescription diets?
Really, that's it. So whenever we're talking about the best food for your dog or cat, it's incredibly individualized, as you can imagine, just like it is for humans. You know, there are hundreds and hundreds, I think it's in the thousands now, of brands of dog and cat food out there. And certainly there's going to be things that we avoid, but the one thing that I would say that you want to look for is you want to make sure it's AAFCO approved, AAFCO, AAFCO approved. That's the regulating agency, which means it's balanced for your dog or cat's age that you're wanting to purchase for. And we want to make sure that you've just talked to your veterinarian, that there's no underlying health risks that your dog or cat would benefit from a different, what we would call prescriptive or therapeutic diet instead of some of the over-the-counter, what we call maintenance diets for every day for those dogs or cats that are otherwise healthy. There are, though, as you reference, prescriptive or therapeutic diets. So these actually require a prescription from your veterinarian that are dentally formulated. And like I mentioned, the most common one is Hill's TD. They came out with the technology first. I think most people are pretty familiar with that tooth diet, TD. And I know a lot of people will feed that as a maintenance diet. What we can do also is I have a lot of clients that are really happy using those, the kibble of the diet, actually as treats. So it's a great way to give that dental care that day as a treat without, let's say, you know, it's been a busy day and you're home late, or you've been traveling, or you've got a pet sitter and just really can't get in the mouth, to give those as actually treats because they have research behind them to show they absolutely improve the health of the teeth and gums. It's not, it might help, or studies show, kind of a generalization. This is actual university-based studies that show these will improve your dog or cat's mouth. So a great option to talk to your veterinarian about.
Awesome. A couple more questions that we had. How often should I be brushing my puppy's teeth? And that's daily, right?
Well, in a perfect world, just like with humans, it should be daily. Couple things on that. It should be 3 times a week, minimum, to make it worth your time. So a lot of people I think I would say some of my older pet parents that I have as clients, and they have a new dog and they want to start brushing. And I say, well, when did you last brush? And they're like, yesterday. And I'm like, awesome. And when was it before that? And they're like, last year, the day after our exam. So other people think, oh, well, my dog gets his or her teeth brushed every time he goes to the groomer, which is every 4 to 8 weeks. If we're only doing it then, we might as well not even do it, because there's really no way to make up for lost time of what's accumulated in that 8 weeks time in just one brushing session. So if brushing is just not your thing, I love telling pet parents, just be transparent with me. I would much rather know from the beginning, I'm just not going to brush my dog or cat's teeth. That's totally cool. Now, thankfully, we have so many other options I can give you if brushing is just not your jam. Like I know I won't do it. I don't have the time. I have 4 kids. I have 2 jobs, whatever it is. It's not about judgment. It's about finding what's going to work for your family. So brushing, if you're going to do it, if you're going to commit to it, at least 3 times a week in a perfect world every day. And we only want to do, and this is going to sound crazy, we only want to do 5 back and forth strokes on each side. So 1, 2, 3, 4, 5 on the other side as well. And then on the bottom, you do not have to go into the mouth on the surfaces or on the inside of the teeth. Okay. So lift up the lip, 1, 2, 3, 4, 5 on each side, and then be done. If there's any blood, stop and be done and talk to your veterinarian. Because the last thing we want to do is for you to do all this great work training, have one incidence where there's gingivitis or some other thing going on that causes bleeding. And then your dog or cat says, whoa, that hurt. Mom or dad hurt me. I'm not going to do that again. And then we have a really difficult time taking a lot of steps backwards and retraining a positive experience. So make sure you don't overdo it. I have a couple clients that use electric toothbrushes, and I would say that's not probably the starting point for a new dog or cat. But if your dog or cat really loves it because you've done a great job training, the electric toothbrushes, some dogs or cats really enjoy the vibration. So again, I wouldn't start there, but if you want to try it at some point, if your dog or cat's really showing you they love it, that's another option too.
Awesome. I can't even imagine using an electric toothbrush.
I know I've seen it in action. It's really adorable, but yeah, not starting point for sure.
Makes sense. You kind of touched on this when it comes to cats. Someone asked, my cat has bad breath and I'm worried about her teeth. I'd like to try brushing on my own, but she won't let me get near her mouth. Any suggestions?
Yeah. So I would say to Eli, the first thing is if we're worried about dental disease, which you have every reason to based on the fact that your cat has bad breath, the first thing I would do is schedule an appointment with a veterinarian to actually look at the mouth. Because two things. One, there probably is dental disease there, and it may be at a level that needs a veterinarian to intervene under anesthesia, maybe dental x-rays, maybe extractions, maybe antibiotics, who knows, just kind of hypothesizing here. But it may be at a level where home care is not the best starting point. And two, if there's something that is painful in the mouth and you start to really struggle to force your cat to accept your hand being in the mouth or a toothbrush in the mouth, that is often when we see bites, scratches, destruction of the bond, and often those cats that end up seeing mom or dad coming in and running and hiding under the bed. So I wouldn't feel comfortable saying these are great home care options until we assess your cat's mouth and maybe say, oh, actually it's just a little bit of plaque. That's great. And then the best way to start with that is to associate having the mouth touched on the outside with a yummy treat. So it'd be literally just touching the outside of the lip and giving like sardines or tuna or tripe or something super, super yummy that your cat will not resist. So that every time you do this, they look for something good, or they start to their mouth waters because they remember what that means. Then you start to just work by going in the corner. Same thing. And then we work up, and it may take several weeks to get to that point of accepting. But if your cat has dental disease and is painful, that's not the ideal time to start that training, because you're going to be kind of up against a roadblock with how your cat already doesn't feel great there.
That makes sense. And then in the meantime, while you're in that training process, you could use like the dental treats, the greenies.
Yes, absolutely. Yeah. The rinses for the water so that you don't even have to go near your cat's mouth. Yeah, greenies are great. Most cats really accept them. There are also CET chews. That's another brand. They look like combos. It's the best way to describe it, like that, like rolled tubular snack you get at gas stations. Like they look like that, like a little roll with something in the center. Those are pretty widely accepted, yummy dental treats for cats as well. But I would say choosing something like that would be, again, hands off, but positive. The key with the dental chews, especially, is you really want to choose something that says enzymatically active or enzyme acting, something that has enzymes on it, because that has to dissolve the plaque so it can wear away. Otherwise, we're just giving a bunch of more calorie to our dog or cat, and it's really not effective. So when you're looking at packaging, either check out the Veterinary Oral Health Council site for a great option, or at least make sure it says enzymatically active.
Perfect. Someone asked then, like a follow-up question, clean teeth gel by Fresh Breath. Would that be a good product to use daily and then supplemented by brushing at least once a week for a 7-month-old puppy to keep their teeth clean?
Yeah, I think that's a great strategy. The one thing I would say is, when we look at effectiveness of all of these different options, whether it's brushing or chews or rinses or gels or wipes, there definitely are studies that show that brushing is most effective. So you're going to see the most success with brushing and then kind of going down in order, whereas the rinse that you'll put in a water bowl is going to have the least impact. It'll have some, but not at the level you want. So if we're going to use the clean teeth gel, which I think is a great at-home option, the only thing I would say, Alexander, would be to try to brush maybe 1 or 2 more times a week, just so that we can have the maximum benefit, especially if your 7-month-old puppy really loves it. So if you've been doing the gel every day and your puppy's like, yeah, come on over here and give this to me, and feels happy and is wagging his tail, and it's not a stressful event, then I would try to encourage brushing a few more times a week if you can, just because that's going to really help physically remove the plaque from the teeth so that bacteria doesn't go under the gum line.
Perfect. All right. I think that's all we had, because that website has brand recommendations, correct?
That's right. Yep.
Perfect.
It's a great source.
Awesome. All right. So if anyone else has any questions after today, or you encounter something that you're unsure of, you can utilize the AskVet membership if you have one to chat with a care coach or one of the licensed veterinarians. If you don't have one, reach out. We'll get you started. You can also download the app in the App Store and sign up for a membership. And if you have any other questions, Dr. Marks is more than happy, I'm sure, to kind of help out. And like I said, utilize the membership benefits that you have with the care coach and the clubhouse. We are here for you 24/7 for support and here to help make you and your pets healthier and happier and having the best life possible. All right. Thanks, guys, so much. And I hope you have a wonderful day. Thank you, Dr. Marks.
You're welcome. See you
Bye,
guys.
guys.